Welcome. I'm Raymond A. Fritz Jr., President and CEO of Allentown Family Foot Care, a practice specializing in the care of the foot and ankle, your foot and ankle. We are now celebrating over 25 years of service in this community, and we are especially excited about the opening of our new state-of-the-art facility on Walbert Avenue. The physicians on this team have nearly 100 years experience. I'd like to have each one of the doctors introduce themselves and tell you a little bit about their background, and it will become pretty evident that there's a lot of experience here at Allentown Family Foot Care.
My name is Dr. Ann Anderson. I'm a fellow of the American College of Foot and Ankle Surgeons and a fellow of the American Professional Wound Care Association. My undergraduate education started at Cornell University in Ithaca, New York, and I decided to attend podiatry school at Temple University School of Podiatric Medicine in Philadelphia, Pennsylvania. Following that, I did my residency in Northern Virginia, outside of Washington, D.C., and then pursued job opportunities in the Lehigh Valley. I've been dancing since I was 3 years old, and I was in a regional company in high school and continued to dance through my undergraduate education as well as through podiatry school. As a young practitioner, I was part of the American Podiatric Medical Association Young Members Committee, which was a committee that tried to foster involvement of newly graduated residents and physicians and acclimate them into the medical community. I also did research on specific inserts while I was in school, as well as some new types of ballet and dance shoes in order to assist companies in production of shoe wear that would be good for dancers' feet. Working at Allentown Family Foot Care has been a good fit for me. It allows me to practice both non-surgical and surgical procedures. I've established long-term relationships with many patients, and I really enjoy the camaraderie between the doctors and the staff at the office. I think podiatry is an important part of the medical community. We interact with many other types of physicians, and the unique thing about podiatry is that many foot conditions can be treated both surgically and non-surgically. We specialize in orthotics and braces for patients who want to maintain activity in sports-related fields, through different shoe modifications and different shoe types for patients with medical concerns that require specialized shoe gear. I participated in the Desert Storm Parade in New York City when I was a teenager. Our dance instructor had a whole dance troupe go down to New York City and perform, and footage of our performance was featured on The Tonight Show with David Letterman. Well, it was awesome to see yourself on TV, especially dancing, doing something I love.
Hi, I'm Dr. Laura Baker. I've been at Allentown Family Foot Care here as a doctor for the last 14 years, and I've been with the practice about 20 years if you count all the training that I've done throughout Muhlenberg as well as Temple Medical School. My interest had been piqued in podiatric medicine as a career, being that I enjoyed running, and I came here and met Dr. Fritz about 20 years ago to see if this was the profession for me. Progressed on to residency, surgical residency at Parkview Hospital in Philadelphia. That is where I became surgically trained and progressed on to practice here. I am a fellow of the American College of Foot and Ankle Surgeons. I am board certified in forefoot surgery. I'm board certified in forefoot surgery. I am also a fellow of the American Professional Wound Care Association, and my passion is definitely orthotics and bracing. I love running. However, treating all aspects is what makes my life interesting. Outside of the office, I love to run. I recently became active in the cross-country team at St. Joseph the Workers' School where my children attend. I'm definitely a soccer mom. I have the minivan to prove it.
I'm Dr. Kevin Short. I went to Susquehanna University in central Pennsylvania, where I majored in biology. At that point, I went on to graduate school at Drexel University, where I studied biomedical science. I'm from Emmaus High School. I played football in high school as well as in college at Susquehanna University. From there, I went to Temple School of Podiatric Medicine, where I was involved in various clubs and organizations. From that point on, I did my residency in the Palm Beach area of Florida at JFK Medical Center. It was a 3-year surgical program where I did a lot of forefoot and rear foot reconstruction, including lots of trauma. My main connection for getting to know the owner of the practice, Dr. Fritz, and the practice itself was one of the main surgeons who trained me at my program in Florida, also went to school and is very good friends with Dr. Fritz. His name is James Clancy. So that was sort of the connecting factor that got me and led me back to Pennsylvania, which it was good to come back home because this is originally where I'm from. So it's nice.
My name is Dr. Philip Jimenez, and I'm a doctor of podiatric medicine. I went to undergraduate school in Kean University. There I took my Bachelor of Science degree. I furthered it by continuing my education through podiatry school, which was New York College of Podiatric Medicine. After graduation from the 4-year college, I went to St. Michael's, Newark, New Jersey, for my residency, 3-year residency program that basically entailed all aspects of podiatry, from wound care, surgery, emergency room, treating young children, adults, and elderly. My initial work took place at a pain management, so encompassing other faculties such as physical therapy, chiropractic care, became my mainstay for understanding much more than just the feet and lower extremity, but the whole body in general. My interest for pursuing podiatry was had to do much more with my grandfather. He was a diabetic, suffered for a long time. If I actually, or if my family knew that what a podiatrist could actually do to help him, he probably would have lived a little bit longer. So it's, in essence, I wish we knew a podiatrist who would be able to help my grandfather at the time while he was suffering so much. So it's the attention to detail. I feel that I can connect with the patients a little bit more, so that I'm much more understanding to the issues that they have and not rush what other facilities are more likely tending to do, and just give us the peace of mind that we're in an area that is people are comfortable being treated in, and comfortability is a lot of the times what the patients their outcomes of their problems are much better when they are comfortable from beginning to end. Fun fact, just been married for about 10 weeks now, so new area, newlywed.
Hello, I'm Dr. Randy Smargiassi. I went to undergraduate school at East Stroudsburg University. Went to podiatry school at Temple School of Podiatry in Philadelphia. Did my residency at the VA in Baltimore, Maryland. After my residency, I was in the Navy for 9 years as a podiatrist in and around the Washington, D.C. area. I think one of the highlights of my career is being assigned to the White House Medical Unit and the Office of the Attending Physician at the Capitol in Washington, D.C. I've been with Allentown Family Foot Care since 2008.
It's been a pleasure having this opportunity to introduce you to the excellent physicians that we have here at Allentown Family Foot Care. I am confident we can meet all your patient needs. We will treat each and every patient as if they're a member of our own family. We welcome you here. We have an excellent staff. We are standing by to serve. We have same-day appointments nights, Saturday hours. We take our patients' schedules into consideration. We are here to meet your needs. We want to keep all of our patients active and on their feet.